Hi, this is Dr. Nelson, your Utah Wellness Doc with Freedom Healthcare. Today I want to talk to you women about the importance of testosterone for women. Women's ovaries actually make testosterone. In fact, a little known fact that most doctors don't even realize is that women's ovaries make more testosterone per month than estrogen. And this happens during your peak health portion of your life, from about age 16 to around age 30, and then it starts to taper off. The reason most people don't realize this is that on lab reports, testosterone is reported in one unit and estrogen is reported in a different. If you convert them to the same units, you'll find out that women's ovaries actually make a lot of testosterone. Not nearly a man's level, but it's absolutely vital for a woman's health. And let's talk about what those health benefits are. First off, testosterone drives weight loss, weight control in women. So a lot of women come to me having just a hard time controlling their weight after around age 30, 35, and that's when their testosterone really takes a dive. So testosterone drives fat burning and muscle retention. So once women reach that kind of 30 to 40s, they go from a fat to muscle ratio like this, and it starts to go the other way. And if that continues without any testosterone replacement or supplementation, by the time you reach 60, 70, or 80, we've really withered away and have hardly any muscle mass. And too much fat mass, which leads to all kinds of other health problems. Testosterone also drives mood. Testosterone is a mood enhancer, and it really improves our enjoyment of life. So a lot of psychiatric benefits. Another common thing I see is women coming in mid-30s where they've never suffered from anxiety or depression, and now they are. And it's not because they've all of a sudden developed a deficiency of Prozac, but they've developed a deficiency of testosterone. So this can be used as a tool to help improve mood in women. Testosterone also really reduces joint pain. I've seen this over and over. People with arthritis, they get a benefit from going on testosterone, and the progression of arthritis slows down. And actually the pain will often reverse a little bit at the beginning. Testosterone also drives bone density in women, which is vital. After about age 40 or so, women start to lose bone, some more rapidly than others. And if a woman experiences a hip fracture because of bone density problems, just the health problems and the risk of death within the next 1 to 5 years of a hip fracture skyrocket. So protecting your bones is a vital function of testosterone. Testosterone improves libido and the health of vaginal tissue in women as well. It's a driver of libido, and so a lot of times women lose their libido during that 30 to 40 age range, and this is why. Another very important function of testosterone is it reduces breast cancer. Testosterone is actually what is called apoptotic to breast cancer cells. That's a medical term which means it actually kills breast cancer cells. So as women lose their testosterone, their risk of breast cancer goes up. So then the question is, well, how do women take testosterone supplementation? There's 3 main methods, and any one of them is a great choice. The most important thing is that women choose the method that they will be most consistent in using. The most expensive way to go is testosterone pellets that are inserted under the skin every 3 to 4 months. Now these are bioidentical testosterone. It's the same kind of testosterone your ovaries used to make at higher levels. These pellets are inserted under the skin in the upper outer portion of the hip or the upper gluteus area. And this is a great method, not the most commonly chosen because of its cost. The second method, which is, it can run currently about $20 to $30 a month, is using a testosterone cream. And the cream is easy to apply. You just take a little bit of the cream and apply it to a thin skin area once or twice a day. And the last method, which is the least expensive, and all of these, by the way, are bioidentical testosterone. The third method that I want to talk about is injections. And this is actually a very commonly used method. Women are often a little afraid of the needles at first, but it's a tiny needle, and the first time they do it, they're like, oh, what was I worrying about? That was nothing. So it's a little tiny injection with an insulin needle that can go straight in under the skin, in the belly area, on the side of the abdomen, or on the upper outer hip, just twice a week. So that is a quick summary of testosterone in women. Come on into Freedom Healthcare if you have questions. We'd love to talk to you about this. and help you restore and improve your health as you age.